And a good Saturday morning to you. Welcome once again to Health Matters with Dr. Jim Warner. And once again, we have as a special guest Kim Osborne, who's doing some intern work there at Warner Chiropractic in Rockford. Good morning.
Good morning. It's good to be here, Fred. Dr. Kim and I go back a few years. She was a patient of mine and was so enthusiastic about chiropractic, she decided to become a chiropractor. And so it's kind of great that part of her education now is doing an internship, and she's able to come to our office 2 days a week as part of her internship, and we're working together and having a good time of it.
So how far are you away from completing your studies?
Well, I'm about 1 year. December I graduate, so a little less than a year.
And you've been at it for how many years now?
I've been at it, did my first 4 years before I had kids about 12 years ago, and then I've done the last, it's a 5-year program. I've done it in about 3.5 years.
So it's about 8 years of studies there.
Yes, yes.
Wow. That's an amazing thing. And of course, you found out, Kim, that chiropractic was able to help your daughter make a big difference in her life, and so you kind of have been pursuing chiropractic ever since.
Yes, I've definitely become a believer, so.
She was telling me on the way here today, Fred, that she was originally studying to be a physical therapist and then more pre-med, and when she decided to go into chiropractic.
Very much a related field.
Yeah, they're all related, and the basic sciences are the same, just the treatment methods are different. And one of the methods that we're going to be talking about today is the Activator method. We've talked about it last week, but we're going to talk a little bit more about the Activator method and how that is a little bit different than other chiropractic methods. And so maybe Dr. Kim can tell us a little bit about that.
Well, we talked a little bit last week about the leg length analysis and how we look at the legs and the hips to make sure that they're level. And some other things that we do with that is we'll have the patients, when we're treating them, do different motions. And what we're looking for is areas in the spine that might be crooked or out of place. And then that will tell us by the leg length again where to treat at. And so that's really how we focus the treatment when we do that. And some other ways that are treated is more of a traditional chiropractic adjustment. Something that most people associate with it is the actual using your hands and manipulating the spine or crunching it, as some people might say. So,
well, sometimes bones, when you're adjusting, will make a little snapping sound, and I suppose that's where that idea comes from.
Yes. Now, the interesting thing about this Activator method, we mentioned it last week, that there's no pain involved, and it's more of a clicking sensation that you have, and the bones are put back in place. But the really interesting thing that I like about it is not so much the instrument analysis, but or the instrument adjustment, but the actual analysis that we use before we give the person an adjustment. For instance, Dr. Kim talked about looking at the leg length. One of the tests that we always do to see is one leg shorter or longer than the other. And is there an adjustment to the hips or to the spine that will straighten out this leg length deficiency?
Now, you look for, let's say my right leg is a little bit longer than the left before the adjustment. Where do you go with the Activator to make that adjustment?
Okay, we start at the knees and work up. And then we'll see if there's an adjustment that straightens that out. And if there is, then we know that might be causing the problem. And so let's say we saw your left leg was shorter than the other, and we adjusted your hips, and we just proceeded to go up your spine, and the legs now are perfectly even after we gave you the adjustment. Then let's say we had you tuck your chin down to your chest, Fred, and then we looked at your leg length, and the left leg pulled up when you tucked your chin down. Then that would tell us that there's a bone out of place at the top part of your neck, right where your head and your neck come together. And if we fix that with the chiropractic adjustment and then have you tuck your chin down your chest again, this time the legs will stay even if we fix the problem. And so it's a neurological testing procedure that we use, and we start at the feet and we work all the way to the top of the spine. And when that person walks out of our office, we know that that person is perfectly balanced. Legs are even, all the spinal segments are moving properly and in good alignment, and the person getting off the table can tell a huge difference.
I know they can, and you can basically right away after you make the adjustment, if you found a problem, you can see the difference immediately, can't you?
The response is immediate, and that's one way that we can check and know that we've adjusted the right areas, and that was an effective adjustment for the patient.
Let me give you a good example of this, Fred. We had a young lady come into our office this past week, and she had been to 2 neurologists and with severe headaches of 4 months duration. The headaches never left for 4 months, having severe headaches lasting all day long, vomiting.
That's basically a migraine, isn't it?
Terrible migraines. They said she had layered migraines, one after another, after another, after another, and nobody could help her. And she came into our office, and we checked her and could see that there was a spinal misalignment. That, when we do the tests, we could see that the neck wasn't working properly. So I asked her, I said, have you hurt yourself? No, haven't hurt myself. I mean, did anything happen in February? No, nothing happened. I said, have you ever been in a car accident? Well, yeah, but that was back in December. I said, well, okay, so that was a couple months before, and we x-rayed her neck, and we found that she injured herself back in December.
When did the headaches begin?
Started in February.
Sure.
And this went on for months, this pain, but she was giving medication to try to deaden the headaches, but not getting to the root of the problem, whereas now we know what the root of the problem was. It was an accident that put some spinal bones out of alignment. Now we're using the activator technique to put those bones back in place, and those headaches are going to be gone.
It's an amazing thing if you can pinpoint, when they started, and if they haven't had them before, there's something causing it.
Yeah, and sometimes people get in a car accident, Fred, and the symptoms don't start for a month or two later, and then they don't put the two together.
Sure.
And so that's why, we encourage people, if you're ever in a car accident, get checked. Even if you go to a hospital and have them check you, at least you have something down there. They'll take some x-rays or something that you can follow up on later to see if what's causing this.
I know that's commonly called whiplash, and some people don't really believe there is such a thing, but those who have been in car accidents know that there is such a thing.
Absolutely, and oftentimes, though, patients don't realize that accidents where you're going 15, 20 miles per hour, they wouldn't consider that an accident. They wouldn't consider that they would have problems in their neck, and that's oftentimes where we do see the problems. So sometimes they may not have like gross problems in their neck where they can't turn their head, but if we're able to evaluate the spine, and we look at the x-rays differently than the medical doctors do, and so if we can evaluate those things, we can usually help them.
Dr. Jim, in fact, you told me that sometimes in the lower speed accidents, because the body of the car doesn't absorb that impact, it's not dented, then the human body takes more of the brunt.
Absolutely, you're right. Sometimes when someone's in a severe car accident and that car looks like an accordion, the person inside doesn't move that much. It's the car absorbing all the impact. But if it's a low impact injury where the car does not crunch up like an accordion, then the body gets jostled around, and then you get soft tissue damage to your spine. And so when people go to, as Dr. Osborne said, they look at chiropractic x-rays different than medical x-rays because the medical doctors will most of the time look to see if there's something broken or fracture after an accident.
And that's usually what an x-ray will show.
Yeah, and they'll say, well, there's no fractures. But chiropractors not only look at that, but we look at the relationship between the bones. Is one out of relationship as opposed to the others? And if it is, even if it's not broken, that doesn't mean that there's not a lot of neurological damage or that there's soft tissues that are torn. And sometimes we'll take x-rays with the chin down, another time with the chin up, and just see what it looks like when you put motion into the x-ray and look at it that way.
Isn't there another type of imaging that can tell about soft tissue other than x-rays?
Sure. Magnetic resonance imaging, or an MRI, as most people would know it, will show up all of the soft tissues as well. And sometimes that's necessary to evaluate the damage done.
It's something that athletes all the time you hear about, well, they're going to give them an MRI. The x-ray didn't show anything, but they're going to have an MRI because they know there's a problem and they need to find out what it is.
MRIs do a great job of seeing soft tissue damage, and that's what we're looking at. And soft tissue damage is usually worse than hard tissue damage. If someone breaks a bone, you can cast it, and in 6 to 8 weeks, they're all right. But if you tear some ligaments that are holding those bones together, you're talking about something that may be there for years or forever.
And do you treat those in a much different way if it's soft tissue rather than a bone?
Well, you use the activator method because that's so gentle that even after a severe accident, they can have a gentle chiropractic adjustment to put the bones in a more proper position, and then it can heal in that good relationship and not heal in such a way that those bones are out of alignment and causes a permanent problem.
Now, is there a place for when a person gets a knotted up muscle? Maybe it's caused by a nerve problem or something like that, and you use the activator, but the muscle is still real tight. Is there a place for either using those muscle relaxants or actually working on the muscle itself?
Sure, we can use the activator actually on the muscles, or sometimes we'll do like a massage to those areas, to the muscles, to work that. A lot of times when we treat the actual bones, the muscles themselves relax in response to it because those muscles are tightening up to protect those bones and to keep them where they're at. So when we fix the bones, the muscles oftentimes will relax. But if not, we can treat those as well too.
We have a massage therapist that works in our office, and we have physical therapy pieces of equipment, electrical currents, ultrasound, traction units, deep heat. We have many different things to treat the muscle itself also. However, that's ancillary. That's something that we do in addition to, not instead of a chiropractic treatment, because a lot of times people will go for physical therapy, but it's just treating the muscle,
right,
and not treating the underlying problem. So we try to do both in our office.
And that's one of the reasons why the activator is so effective, because it gets to the root of the problem.
Absolutely. We can go in and adjust exactly what needs to be adjusted. And like you said, with someone that has some acute injuries and that, we can still treat them real effectively.
Well, I know that Dr. Warner has a website, and he even will email you if you'd like to be on his email list, because I'm on it, and I'll get some interesting articles on that.
Yes, they could contact us at www.warnerchiro.com, and there's a whole section on the activator method there.
All right. And the phone number at Warner Chiropractic is?
815-398-8111.
That's correct. Good job. Thank you, Dr. Jim and Kim.
Thank you.
Thank you. Have a great day.
And that's going to do it today for Health Matters.